Good afternoon. Uh, my name is Fred Kellum. I'm from the Office of Services for Students with Disabilities, and it's really a great pleasure to introduce Lawrence Kowalski today. His talk, How to Promote Success in Autism Spectrum Disorder in College, How to Promote Success in Higher Education, is part of a series of talks and lectures that our office is sponsoring this year as part of our 40th anniversary celebration. So it's really a great pleasure to have Lawrence here today. Lawrence works in the Autism Spectrum Disorders program at the University Center for the Child and Family, received his bachelor's degree from the University of Michigan and his master's degree in clinical behavioral psychology from Eastern Michigan University. He's done research gathering phenotypic data, excuse me, from families with one child having been diagnosed with ASD. And he does in-house, in-home behavioral therapy for children with ASD. It's important to note in that respect that he is a board-certified behavior analyst, which is a significant certification to have. He's also had advanced experience and training in administering diagnostic tests for ASD, in addition to a variety of specific cognitive testing protocols. So with that, I introduce Mr. Kowalski.
Good afternoon. I hope everyone's doing okay, considering this is a very typical Michigan springtime day, enjoying the rain. Thank you for the lovely introduction, and I'm an honor to be here, and it's great to be invited by SSD in order to give you guys this presentation, especially because, as I'm sure most of you know, April is Autism Awareness Month. So it's really great to be here. So to begin, there's a variety of things that we're going to talk about today. I hope I don't go too fast for you guys. There's a lot of information. We'll break it down specifically, but an area I kind of first want to address, even just very briefly, is college and how do we view college? Well, what we find is if we go back a long time ago, college was more viewed as maybe a privilege and not really accepted as something that needed to be done for individuals to be able to progress within their careers or their specific areas. And what we're noticing in the with the U.S. Department of Education in the past, in the 90s, we started seeing an enrollment increase in college education, increasing by 11% from the previous decade. And then especially in the early 2000s, from 2000 to 2010, the enrollment increased by 37%, going from 15.3 million to 21 million, which is accounted for. Obviously, there's a lot of people attending school. Some people go back, some people go full-time, some people just go for fun. But that major increase was primarily those going back full-time to college. And this involves also not just major universities like the University of Michigan, but the smaller universities or colleges and community colleges as well. So when we see this increase, well, who is it? Obviously, there's more people going to school, and this includes more people, especially with those with developmental disabilities such as ASD, going back to get college or going to college. And they have some limitations. College is obviously very different from high school life, so how do we best provide supports for them to be able to succeed and do as best they can while they're in a university setting or a college setting, whether that be something like, again, U of M, where most residents live here on campus, or something where they commute, even if it's a community college or someplace like Eastern Michigan, which has a heavy commuter-based student population. So to better explore this first, we have to understand what autism is. And then to do that, as I would think it was Friday, a week ago today, the CDC released new information. I'm sure a lot of you got that. I got that popping up on my phone. We have new data, what the prevalence of autism actually is. They're now saying 1 in 68 children. That is a dramatic increase from 2002 when they said 1 in 150. Obviously, I forget what it was previously, but now it's 1 in 42 boys. We know it's a disorder that's more prevalent in the male population than in the female population, and that most people aren't diagnosed until 4 years of age, which is interesting because especially recently, and we may see a drop in this because it wasn't that long ago that I believe the ADOS-T was released, in that we have measures that can start developing a level of concern as early as 12 months of age. So obviously there's this heavy push for early intervention so that we can provide these supports for kids, and sometimes, especially when we look at the increase, the college age kids, some go by the wayside, unfortunately. So we need to be able to provide supports for them as well. And in thinking about this, as if some of you have experience with an individual with ASD, we're going to know that every individual with ASD, just like everyone else, is unique. They have their own set of strengths, their own set of weaknesses. And we need to play to those strengths and to build up or be able to provide support for their weaknesses. But how do we do that? Well, first, we need to understand how do we exactly diagnose autism. ASD, I know, the DSM5 came out, I believe, in spring 2012. And there has been some everyone has interesting opinions of the new criteria for ASD. We'll put it that way. So I'll go over what the criteria are now, because that's what we're basing this all off of, especially with the new autism insurance benefit in Michigan and the new measures with the new ADOS. They're based upon the DSM-5 criteria. So we'll go off of that and kind of give examples of what it actually looks like, whether it's younger individuals or individuals who are older and more of the college age. And then in doing that, it's also good to note that ASD is a behavioral diagnosis, in that, unfortunately, I can't ask for a blood draw and be able to tell if you have autism. I can't send you to an fMRI or CT scan or MRI machine and look specifically at something and go, there it is. So it's a variety of these behaviors when put together that creates the diagnosis of autism. So when we look at the DSM-5, we now have this two-factor model of what we're looking at within ASD. It has the social communication domain and the restricted repetitive behavior domain. And sometimes within these two, and I could talk about a little bit more later, there's different developmental trajectories and how they present with social communication based upon age or restricted repetitive behaviors. The one thing we do know is that RRBs, restricted repetitive behaviors, sorry, I use acronyms a lot, reduce as children get older. And I also, before we get going, and as far as the DSM diagnosis, want to thank Dr. Fiona Miller, who let me borrow her slides in order discussing this. So like I said before, we we went from a three-factor model in order to a two-factor model in the DSM-5. In the DSM-4, it looked at the impaired social interaction, impaired imagination or communication, and then the restricted and repetitive or stereotyped interests. Now we're specifically looking at the persistent deficits in social communication or social interaction and restricted repetitive behaviors or interests, really kind of collapsing the impaired social interaction and the impaired imagination communication, because those go together. We use both our social interaction skills and kind of like our verbal and nonverbal skills in order to communicate, and so they're not really separate. They should belong combined. There's 4 different categories within the DSM-5. The first category, Category A, is persistent deficits within the social communication and social interaction domain. And it has to be, there's 3 separate subdomains within this that we need to have or see behaviors that are persistent across all of these areas. So the first one is the deficits in social emotional reciprocity, ranging from an abnormal social approach and failure of normal back and forth conversation, reducing shared interests, recognizing emotions, or the total lack of initiation or social interaction. What this is trying to capture is that within ASD, obviously the conversational piece is sometimes very difficult. When 2 people interact, especially together, we have this, what we call a reciprocal conversation. Somebody provides some kind of verbal stimulus, the other person reacts and builds upon that verbal stimulus in order to create this conversation that builds upon itself. Sometimes that back and forth, that reciprocity, individuals with ASD have difficulties with. They might also have one-sided conversations where they'll talk your ear off about something, maybe their interest, and not providing you opportunities in order to engage with them in the conversation. It looks like a conversation, but it's really not involving the other person in it. Or have difficulty staying on topic, in a conversation, or talking over the other person. Again, knowing that the social enterprises and how we interact with somebody else and how a conversation works, well, it's a back and forth, it's a give and take, and I can't hear what you're trying to tell me, or you can't hear what I'm trying to tell you if we're talking at the same time. Another thing we notice is that they have difficulty following conversational bids. Conversational bid could be something just as vague as, well, man, it's really rainy out today. And that is a lead-in for a possible conversation. Or something more specific and blatant of, I did something really cool this weekend. And even though it's blatant like that, they have a hard time and difficulty picking up on that to then follow that lead and to figure out, well, what did you do? And then within conversations, we use a variety of techniques, especially verbally, to initiate, maintain, and then end the conversation as well, instead of having it just kind of drop off and then go nowhere. So in the second subdomain, it deals with the deficits in nonverbal communication behaviors used for social interaction, ranging from poorly integrated eye contact and body language, or deficits in understanding and the use of nonverbal communication or lack of facial expressions. So when we communicate, there's obviously the verbal basis of communication. I express words that you guys can hear. Sometimes we also have, and if I didn't have this podium, the podium always restricts me, I talk emphatically. I use a lot of this. So we have different types of gestures. We have emphatic gestures kind of go with the beats in conversations. We have descriptive gestures. I'm a fisherman, I like to fish, so of course the fish I catch is always this big. I'm able to describe something for you with my hands without actually saying anything. Or the information gestures. The best one that I could think for that, especially like a 2-year-old on their birthday, how old are you? I don't have to say anything, but I can provide you information just non-verbally. Eye contact. Eye contact is also integral in the fact that we can regulate, modulate in our social conversations with that. I try to make a point of that as I'm scanning the room and trying to make eye contact with certain people, and that way, it's a form of communication. I'm communicating to you. Facial expressions. What we see with an ASD, they have facial expressions, but they may not be directed. When we direct facial expressions, we can let other people know our emotional extremes. Am I happy? Am I finding this conversation or this lecture really boring? Am I interested in what's going on? And then reciprocally, can they be able to tell based upon the facial expression that they're seeing and how that person is doing and how they're feeling, and then regulate their own behavior based upon that? And then with this, we have the way we integrate our communication. Because if I'm talking, again, without the podium, I'm probably verbally communicating information to you while using my gestures to show you that the fish was this big, or trying to interact with somebody or calling somebody out, things like that. It's how we use them together in order to effectively communicate. And the third and last domain within Category A is the deficits in developing and maintaining relationships appropriate to the developmental level, ranging from difficulties adjusting to behavior to suit different social contexts through difficulties in sharing imaginative play or making friends and apparent lack of interest in people. That's a very long and lengthy way of saying they have difficulty maintaining friendships, and that sometimes we might see them more isolated and choosing to be by themselves, or having difficulty being able to interact with someone or know that someone is their friend, having unrealistic expectations of friends and understanding the levels of friendship, like knowing that person can't always be available for me, or that if I called, that person's going to answer the phone. They might have difficulty interacting with groups. Sometimes we see that within ASD, they can be comfortable interacting maybe on the one-on-one scenario, but as soon as we introduce more individuals, more peers their same age, they have difficulty interacting at that point. And guess what college is? It's a lot of peers your own age. Lecture halls, I was trying to look up how many seats a largest lecture hall has here. I was able to find out it was the chemistry building, but I don't know how large it was. I know Angel Hall has a lot of lecture halls that are huge, but they're over 100 people. That's a large group we have to interact in. And then how we change our behavior in different environments. Lecture halls are usually quiet. Maybe in a discussion section, there's more communication and more talking that's allowed. So within Category A, some kind of behavioral deficit needs to be present in all three of those subdomains. In Category B is the restricted and repetitive behavior, or patterns of behavior now, interests, activities manifested by at least two of the following. So there's 4 subdomains, but we have to notice behavioral deficits in at least 2 of them. The first one is stereotyped repetitive speech, motor movements, or the use of objects. Within this, so stereotyped speech is really language that we've heard someplace else and that we're replicating. And not only is it replicating language, it's also replicating the intonation of language. There was a child that I had worked with before. I don't know how many of you are familiar with it, but there was a cartoon that used to be on Comedy Central. Involved a professor, and he always began everything with, "Good news, everyone." I can't replicate that intonation. However, there was a child who walked in, good news, everyone. So that might be somewhat appropriate to the social interaction there, the social environment trying to initiate with you. However, it's still a stereotyped piece of language that he's using, even though he's using it semi-functionally. We also have idiosyncratic language, which is kind of the odd or indirect way in communicating. So within idiosyncratic, there was a child that, within the ADOS tapes that we have for diagnosis and reliability, there's one child who talks about the examiner came to be that, I think it was May, maybe, but their birthday was in the same month. And her response was, well, you're both inside of here. So it was a very odd and indirect way of saying, we had the birthday in the same month. But it was, and in that social context, the examiner was able to tell, because obviously it was immediate, it was during that conversation she's trying to say that, but she's saying it in that odd and indirect way. We also have neologisms, which are essentially made-up words, and they use them functionally. And sometimes you're probably going to ask yourself, can you repeat that? And they'll say it again, and you have to find out that it's a made-up word, and you have to explore what this word actually means to them. In the second subdomain, sorry, I thought I was off on my notes. We have the excessive adherence to routines, ritualized patterns of behavior, verbal or nonverbal, or excessive resistance to change. So within this, especially maybe more in the college setting, I've dealt with individuals both in high school and later on. Sometimes when we don't have that structure, they do very well with structure. They have a lot of difficulties when there's no structure, and it's kind of just this free-moving environment where we can interact however we want. Something as simple as that there's no assigned seating in the classroom. You guys can sit wherever you want in this area here. However, if a seat becomes your seat, and then one day you get there late and it's taken, having difficulty being able to separate from that seat. And then, so it's not only the insistence on sitting in the same area, but it's having difficulty coping when they're not allowed to follow that pattern and that ritual. Or something like going to school, taking the same route. What happens when there's construction? Because Michigan has 2 seasons, winter and construction season. 96 is going to be closed for 7 months soon. It's probably an exaggeration, but if we take that same route every day, what do we do then? Do we even know another route? Routines with food, they might only eat certain foods, or insistence on following a verbal ritual and having you follow the verbal ritual. In that, what I think of this, I always think of a child I used to work with, in that, well, if I do something wrong, I say I'm sorry, and you say it's okay. What happens when you don't say it's okay? Say it's okay. They're telling you, they want you to complete that verbal ritual and tell them that it's okay. We also have highly restricted and fixated interests that are abnormal in their intensity or focus. And with this, so there's the circumscribed interest, which may or may not be appropriate to developmental level, and then preoccupation with unusual objects, things like that. Some things we often see with this are things like animals. For younger kids, even when they get older, Thomas the Train, that's always a big one. Or trains in general. I don't know how many people here have seen The Big Bang Theory. Sheldon. He's older. I would argue maybe his interest in trains might be appropriate developmental level. However, he's a physicist, supposedly. So it might be, it's a circumscribed interest that he presents with. And the hallmark of this and these strong interests is that it actually affects and interferes with their daily functioning and social interactions. Because maybe the individual, college age or younger, would be able to have a conversation. However, they can only have conversations about their fixated and circumscribed interests. Or their best conversations are about their circumscribed interests, because they can talk your ear off about that because they know everything about that. We also have the last subdomain in Category B, which is the hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. The big one we see normally with this is peering, so kind of staring at things out of the corner of your eyes. Loud noises. So usually individuals with ASD don't like, sirens, ambulances, things like that, or interesting noises like coffee grinders or the vacuum. Or maybe feedback from lecture hall speakers. And we normally see their behavior with them, they cover their ears when they're presented with those sensory inputs. So within Category B, we have those 4 subdomains, but they only have to meet criteria in 2 of them. And lastly, Category C, the symptoms must be present in early childhood, but they may not fully manifest until the social demands exceed the limited capacities of the child. And symptoms together limit and impair everyday functioning. So it has to somehow interfere with them to be able to get along with their everyday activities. So again, we got to think about this, and everyone's unique. So within the stereotype language, restricted and repetitive behaviors, there's going to be different behavioral presentations of it. It's the same kind of category, even though the interests may be different, but the presentation is the same. And lastly, what's probably most important, they have to meet criteria on all of these domains across A, B, C, and D. I used to work with Dr. Lord when she was here at the University of Michigan, and the one thing she would say is that everyone has an ASD-type behavior. I've been told recently that apparently mine, it had to be brought up to me, was that I have a restricted interest in U of M athletics. I thought I used a lot of stereotype speech, but apparently not. But I don't fit that overall presentation, at least I've not been told that I do, across all those domains. So even though we might present with one of those behaviors, it has to meet the criteria across all of them. So when you specifically look at some of the changes to the DSM-5 suite, like I said, we have the 2 core symptom domain and model instead of the 3, with the social communication and restricted and repetitive behaviors. I apologize, that's blue with a blue background. You cannot read that. Whereas the DSM-4, we needed 6 of 12 symptoms in any of the 3 domains. So it's more specified now. And then within DSM-5, like I had mentioned, you need all deficits within social communication and 2 out of the 4 in RRBs. And there had been movement in some of the symptoms. Most specifically, stereotype speech moved from the communication domain into the restricted repetitive behavior domain. And the fact that symptoms must be present in early childhood, I believe, stayed the same. And the fact that it has to limit everyday functioning. And then within this, especially when we think of an older individual, what's everyday functioning in college? We'll get to that a little bit later. All right, and now, which is probably the most controversial thing within the DSM-5, there's a single category of ASD with levels of severity across it. Before we had pervasive developmental disorder, not otherwise specified, or PDD, NOS. We had Asperger's syndrome, and we had autism. What we were finding, especially with some people coming in TMAC, they would go through different assessments, and, well, this time I'm hoping for PDD NOS when they've been given ASD before, or this time they're hoping for ASD versus PDD NOS. It didn't matter, it could go either way. However, when we looked at it on the SSC study that I worked on while at UMAC, what they found is there was 12 international sites across the US and Canada. The diagnosis that you got depended more upon where you went than the behavioral presentation of what you had. And that if you go someplace such as California, I believe California at that time, you needed a diagnosis of autism in order to receive services within that state. So the sites in there were more likely to give an autism diagnosis. So in doing this, since it depended, if your behavioral presentation there, you're going to get autism, you come over here, maybe you get PDD, NOS, wasn't uniform. We now have the single category with the levels of severity, which requires evidence of both social communication and repetitive behaviors. And the repetitive behaviors can be done by history, especially when you do a parent interview, the ADIR, because sometimes, especially when you see children diagnostically and you're seeing them from only a limited period of time, you have this question of, so okay, is that restricted or is this pervasive? I don't know how much it is, and you can get more of that history and compare it to that. And then, unlike with the DSM-4, ASD may now be diagnosed with other disorders such as ADHD or language impairments, because we now know those are 2 separate things. We used to combine those things with the symptomology of ASD, and now we find that it's really 2 separate issues that need to be addressed. All right, and additionally, each person needs to be evaluated or described in known genetic level of language, intellectual disabilities, seizures, things of that nature. And we now have this new separate category of social communication disorder to be added to allow for disability within social communication without that restricted and repetitive behavior piece. All right, we find that the single spectrum disorder better reflects the state of knowledge about pathology and clinical presentation. I had mentioned before the levels of severity. They range from requiring support to requiring very substantial support. That we need to gain information from multiple sources, such as the parents, clinical observations, and maybe even a teacher report. And then I apologize again for this being very small, just the level of severity that we have to base it off of. So that's ASD in a very fast nutshell. We could spend a whole lecture on ASD, but I felt it necessary to know how we're actually diagnosing this, what the behavioral presentation we're looking like, then take it, and how can we apply this to a college environment, a college atmosphere. So within doing that, how do we get to college? So the average college age individual, I believe, is 18. On the CDC information that we had earlier, they said the average age of diagnosis is age 4. It's a 14-year difference that unfortunately I don't have the time to cover today, that they've already had supports transitioning, they've already have social skills training, maybe ABA therapy, all this information, all this therapy for 14 years before they get here. They've also had, because I'll be focusing mainly on time at college, we have to spend some time thinking about whether college is good for someone for ASD and what their best level of academic achievement would be, what are their capabilities of, because everyone's different, whether that's, attending a major university, going to community college, or a trade school. So those are all decisions that we have to make before this time. All right, so within transitioning into college, college is a great time of change. I think everyone here would agree with that. And there's multiple transitions that we have in college, and we know that transitions and change are very difficult for individuals with autism spectrum disorder because of the rigidity associated with that. So what kind of transitions are we looking at then? Well, obviously there's the academic transitions. We go from a severely different academic environment in high school, depending upon the high school that they went to, in order to college, especially upon the college environment. The college environment here at U of M is going to be significantly different from your local community college, both size-wise and in the actual physical structure. We have the personal transition. So, we'll talk more specifically about it too. There's a lot of supports in high school where one of the major things in college is self-advocacy, and responsibilities are your own. And you grow personally during college. They're great transition years during that time. And then social transitions that we can experience. So what are some of the main differences that we see in college? And you can find this information. I pulled it off the Autism Speaks website in their post-secondary education opportunities guide. And it really kind of stresses some of the major changes, some of the major transitions, specifically academically, that we're going to see from high school to college. So in high school, teachers often check the work. They grade it. They give you assignments, they grade it, that affects your total grade. In college, sometimes professors assume that you've done the work. There's assignments given, you're expected to do the readings. It's never really checked. It's the student's responsibility, in order to complete it, to participate. In high school, we have teachers prompt for incomplete work. They can go through, Johnny hasn't handed this in yet, and especially with IEPs, which are great, provide them an opportunity to hand things in late. Well, in college, it's the student's responsibility in order to check to make sure they're meeting all the criteria. And that's evident from day one. You're given, usually, or supposed to be given, syllabi the first day of class. It goes over everything, what you're going to be taught throughout the semester, dates for it, what assignments there are, and how the grading scale goes. And then it's the student's responsibility to go through to make sure not only are they turning everything in on time, they're completing everything, and then be able to check to see, where do I stand? In high school, teachers know the needs of students usually, and if they believe that the student needs help, they can provide support right then and there. In high school, or in college, excuse me, we unfortunately don't have the capabilities for that, especially when you have a professor teaching in a lecture hall of over a couple hundred students. So this is, again, the student's responsibility to request assistance. In high school, teachers have a wide range of availability during the day, where they can meet with teachers before class, usually after class, even during class. In college, I would argue there's probably a little bit of that, especially professors, maybe not in the beginning of the class, but after class, they can go and meet with them. But primarily, they're required to have office hours. And office hours usually aren't right after class or right before class. They're at any time throughout the week. So the student then needs to navigate not only how can I get help, okay, there's office hours, but I need to get myself there. In high school, teachers have studied and trained more than likely in teaching methods. In college, I mean, I would argue that it's probably some professors who have trained in specific teaching methods. Each professor is obviously very knowledgeable in the area that they're educated or teaching in, but they may not have specific training in teaching methods for students. In high school, teachers provide information presented during absences. So if you're sick one day and you come in the next day, the teacher's going to hand you, okay, you have to do X, Y, and Z. In college, you're responsible for what you missed if by chance you're sick. Well, how do we access that information? Usually it's through your peers. And if we know we have an individual with ASD, they're going to have trouble or difficulties interacting with their peers. In high school, teachers often present supplemental material to the textbook, and more importantly, they connect it. We can go over the reading, this is what this means, and this is why I'm giving you this information, and making the connections for you. Where in college that may or may not be the case. You're often given textbooks, read chapters 1 through 2, and then presented on something that doesn't typically follow the textbook, and the students are then responsible for making those connections. And sometimes they, I'll talk about a little bit more later, they have trouble making those connections and kind of seeing how they correlate with each other. Teachers write on the board in high school and information can be copied. Luckily, I believe at the University of Michigan it's required, and someone can correct me if I'm wrong, for professors to post their lecture notes before class. So that way they have access, students have access to them. However, even with PowerPoints and the professor either standing up there lecturing or writing stuff down on the board, not everything's going to be on there, and they're going to be responsible for copying down that information or even just that verbal information. And sometimes when you're covering a topic that has a wide range of information that needs to be presented, they tend to go very fast, especially in the 100 level courses. You cover a wide range of information. They used to be called the weed out courses because you go over everything, and then when you find out more of what you want to do, you start narrowing it down. And then two more. So in high school, teachers, like I said, help connect the information. In college, students must make the connection. And then in high school, students are reminded of upcoming due dates. The teachers are usually on them. By the way, you know you have this 20-page paper. I'm sorry, it's high school. You know you have this 10-page paper. Normally due, or due in a week, so you can get going on that and have this weekend to do it. Where in college, it's on the syllabus. You should know about it. So there are major differences, and that's just academically. But what we find, well, that's just academically, and this is going to be a significant transition from high school to college. So how can we transition positively? Well, what we find, or what research finds, is that good social skills aid in transitions. So being able to effectively interact with other individuals, using your verbal communication and your nonverbal communication, especially combined, will help. They have to be self-advocates. Again, I'll get into this more later, but essentially they have to stand up for their own needs. Before in high school, as you could tell, one of the major differences was the teachers will do this, the teachers will do that, and you go to college as well, the student's going to do this. So they have to advocate for themselves. We also need collaboration, and collaboration with individuals that see the student or interact with the student almost daily. So whether that's the high school and the college, family and the college, counselors, mental health professionals, and professors, some kind of communication to cover this continuity of care, making sure we're using the same strategies for individuals with ASD, and just keeping that open line, because that way too, if something develops and we know, I tried this and this works best, we can start integrating that across different classes. And then, so what's the best type of transition plan then? Unfortunately, I made that too small, I can't read. So research has suggested, okay, so what levels, what do we need to provide, ideally? So again, the self-advocacy is the student responsibility. Okay, how can we start teaching them? Because we need to provide them skills. All of this is, especially in college, you learn skills. Skills to study, skills in order to function within everyday life. And one of those is the self-advocacy. The student is responsible for obtaining their supports. But in high school, that's all done for them. So maybe we begin in high school having the student start participating in the IEP process. With doing that, then they can start learning some of the things that are in place there, so that when they come to college, especially when they're meeting with someone from SSD, that they can start saying, these supports have worked for me in the past, and advocate for themselves. Can I have something, either this or something similar to this here? Communication. similar to before. So if we in high school, everyone communicates with each other, and it's usually easier because you're all within the same building. Obviously, across campus here, this is one building out of I don't even know how many, where anyone can teach or have their office. That we need to have some kind of communication with those exposed to the individual, the professors, the staff from SSD, their mental health staff, maybe even their friends and their family, people who provide support and interact with them daily. And then something that had been proposed is the campus summer program. Like I said, college is a very big transition. So college life is a lot different. A typical day of classes in college looks nothing like a day in high school. You're in the same building. You go from 7 a.m. to 2 or 3 p.m. It's class after class after class. Usually there's some kind of schedule to it. Luckily, which we have in college, you have classes on Tuesday, Thursday, or Monday, Wednesday, Friday. Only Friday if you're unlucky too in college. So what can we do in these campus summer programs? Well, we can start exposing them to the college environment. We can have exposure to college courses and see how they're different from high school. You can teach them how to study. We can all study, does not mean we're studying correctly. There's specific study skills that we can then take the time to teach in order for them to be most successful. And probably the most important is to start demonstrating what college life is actually like. So even this, significantly different from a high school classroom. A high school classroom has 4 walls, maybe something up on top of it, and some desks for students to sit at. They have their lockers in the hallway, they can go access things. Whereas coming in here, well, we have classrooms that probably look like that. Then you have the lecture halls. Our place to store all our materials are in our backpack in our homes. We don't have easy access to them. And exposure to dorms. They might be living with somebody that's not part of their family. And that's sometimes very hard, especially if that individual, their roommate, doesn't know about the needs of the person that they're living with. And then when you think about that too, dorms, the bathrooms in dorms, not private. So how do we deal with, I need to shower, but why are there other people here? And start getting them used to just the environmental stimuli of college. And my favorite is that U of M technically has 3 campuses. You have the South Campus, which is mainly the athletic, North Campus, and Central Campus. North Campus and Central Campus are not close. There's dorms on North Campus, and there's dorms here, and your classes might be on the other one. How in the world do we navigate that? How many people here had trouble parking today? There's no parking here. Well, then there's the public transportation system. Well, how do we navigate that? It's all different, and we have to start exposing them to that and providing supports, even if it's during a summer program where they have more staff there that can be like, here's the northbound commuter bus. This one will pick you up here right in front of the CC Little building, drop you off right in front of Pierpont Commons, and your class is here. Because not every student, especially in high school, is used to having to provide their own transportation from the residence besides their parents driving them or the school bus. So within college too, there's 2 separate worlds of college. You have the academic world, which is primarily where everyone's in college, receiving some kind of higher level of education because they want to succeed, they want to promote a career, they want to learn. But you also have that personal world, and the supports need to be in both areas for the individual to be successful. So if we first explore the academic world, well, what does it actually consist of? Well, obviously, first and foremost, it has our classes. But class is just more than class. First, we have to go to class. You have to attend. And while you're there, you have to pay attention. Your physical presence isn't enough. You need to set aside time to study, which means you need study skills. And sometimes there's classwork. Well, we need to be able to complete that. Not only do we need to be able to complete it, we need to be able to turn it in. And then, of course, examinations, either final exams or midterm exams. So that's everything that consists of the classes that we're going to be doing here to support our academics, but in order to do that, we need to stay organized. So what does organization mean? Well, it means I need something like a calendar. So I need to go take my 5 or 4 different syllabi, collapse them down into one central area, so that way I know what's going to happen and what's going to occur. I need to manage my coursework, which means there's different readings I have to do. I have to know what I have to do and when I have to do it, which means I need time management skills because I know I can only spend so long studying for this. If I've got another exam the next day, I need to prioritize that. And we need to have specific study time. There's office hours for professors. Managing class progress. Okay, how am I doing? Should I spend more time studying for my econ test than my calc test because I'm having more trouble with that one? Or should I study for my calc test because that just comes easier to me? And obviously independence in the fact that we're asking them to do that, all this organization themselves. And in order to do that, we need to have, be self-advocates. We need to have some interpersonal skills. So like self-advocacy, self-awareness. So maybe something as simple as, am I in this individual's personal space while I'm talking to them? Do you need to have certain classroom etiquette? Well, obviously, one of the best things, and my wife was giving me this example the other day while she was teaching, because she is a grad student over at EMU. This means I have a question. I usually wait to get called on, except there was an individual. How about this? Well, I have to wait until an appropriate time isn't an appropriate time for the professor to call on me. Or isn't it an appropriate time for me to raise my hand right now? Can I recall this and wait for a pause in the information being presented? And obviously, communication with professors in order to provide the best support. So I'm breaking this down. This says for professors. I would argue this is actually probably should say students or anyone who actually interacts with a person with ASD. Goebel and Schmolsky, I probably butchered that and I apologize, had done some research and reviewing or had talked to professors, and looking at some of the core deficits of autism, and just kind of panel which ones do they find that most inhibited or most affected that students' progress in their work. And they came across the three central themes that they needed assistance with, or they felt there was the most issues. First one being theory of mind. And this one is we're understanding or being able to take the viewpoint of somebody else, essentially standing in their shoes. And kind of like the picture demonstrates, depends on what side of the 6 or 9 you're standing on to what you're going to say it is. I was actually talking with a child earlier today, and they had stayed home sick from school. Siblings went to school before they had decided to stay home sick, and it was, do you think my brother and sister know that I'm homesick? Well, why? What do you think? No, because they left before me. Okay, so we have some theory of mind skills there. He's able to take the perspective of somebody else, say, well, because they left before me, the normal routine is I go to school, so they clearly think I'm at school. Whereas someone with ASD is like, well, no, I'm here because they think I'm here because I am here. So having difficulty kind of taking that perspective of somebody else. And this could affect him in a variety of different areas, like working in groups. There's a lot of group work in college they're going to need supports with. And especially in the social sciences and humanities area, we notice that there's a lot of individuals with ASD, they focus more on the hard sciences, mathematics, things of that nature. And why? Well, it's because 2 + 2 is always 4. 2 + 2 is not sometimes 4. 2 + 2 under certain conditions isn't 4. It's always 4. There's always an answer for it. So being able to take that perspective of something else and apply it to something else are difficulties that individuals with ASD have. We also find that there's a weak central coherence. And what this means is essentially there's difficulty understanding what the big picture is. Sometimes individuals with ASD obtain information in bits and pieces of data and have difficulty putting it together. So if I look at a picture, it's kind of hard, I can't see the forest for the trees. There's a whole collaboration of things that create the forest, not just the trees. I'm taking the individual data points in order to express what I'm trying to obtain from it. So that's where we go, especially in college and information presented. If I'm supposed to read the book, the textbook, the professor is talking about something else and all these material, how do I connect it then? How does this go together? And sometimes we need to be very explicit with how it goes together. Also, we know there's deficits in executive functioning, which is the planning, organization, and strategizing of material and time. And that's a lot of what college is, not only within the academic world, but in their personal world. And then we know, obviously, that they have difficulties with social interaction and social skills. There's social skills groups all over the place to help and aid individuals with ASD. But what does it look like when you're in college? Well, if you're in a big lecture hall, we look at the nonverbal behavior of people while they're listening to the presentation. Everyone's looking forward. That means they're presenting. Some people are nodding, 'cause that means they're following along and agree with what you have. Sometimes, though, they might be looking down, okay? They could be taking notes. Oh, I can tell they're not taking notes. Well, are they sleeping? I don't know. Their head could just be down. Technically, if with an individual with ASD, just because they're not looking towards you, looking at you, does not mean they're paying attention. I do this all the time. I make sure I do a check-in to see if they have if individuals treat with me are understanding what I'm saying, because they're not looking at me. And so, did you hear what I said? Sometimes they're even on the floor, under a table, especially if it's a child, and I'll present information and I go, did you hear what I had to say? And you know what they did? They repeated verbatim what I said. So just because they're nonverbal communication, which they're going to have difficulty with, doesn't present as them paying attention, sometimes they actually are. So what can we do knowing some of these things like theory of mind, social skills, executive functioning, and weak central coherence? Well, we can be concrete and clear in the expectations. I was working with someone recently, and it was, you know, I've talked to my professors and I've told them that they need to tell me when I'm doing well, and they need to tell me when I'm not doing so well. Otherwise, I won't know. So you have to be very concrete and very clear in that manner. Avoid using idioms and sarcasm. We're going through this. I was going through this with my wife, and we couldn't believe how actually ingrained this is in our everyday speech. So it could be something, you know, very obvious. Shake a leg. Well, I want you to hurry up, but somebody with ASD is going to be taking that very literally. Why are you asking me to shake my leg? Or something maybe not so concrete. He's cool. Cool is a word we use to describe that someone's popular, someone's interesting, something of that nature. Sometimes that might be taken as, why is that person cold if he's cool? We need to present information in multiple formats. Obviously, with multiple modes of sensory input, they're able to more retain information if they hear things presented verbally and visually. So especially with the PowerPoint presentations that professors hand out, obviously sometimes even when we're doing things like this, you try to be clear and concise, just give the information they need and build upon that through your spoken language. However, you're also presenting it too, so there's multiple modes of being able to input the information for them to retain it. And then being argumentative and questioning, sometimes again going into that classroom etiquette, what does that actually mean? Well, sometimes they're not being argumentative because they don't agree with you. They might not be trying to be argumentative. They're trying to find out the information. And because of a lack of social skills and being able to read social cues, maybe knowing that it's not the appropriate time for debating this issue, or having a compulsion on being right, or just knowing the information, it's going to come across as being argumentative or questioning. So then with academics too, then there's stuff in the classroom, there's stuff outside the classroom. Where does this all go, and how can we provide supports in those separate domains? Well, sometimes having a note taker would actually be quite useful, because that way we can then present on the information that's being given. So if we think of especially the executive functioning piece, being able to attend to the information being presented, write it down, and understand it, that actually takes some planning. And can you actually copy everything that the professor's saying? So having someone there to actually take the notes for them would provide an opportunity for them to focus more on the information being presented and reading the material if they have it beforehand. Check for understanding of the material or explaining the steps, kind of like I had mentioned earlier. Just doing that check-in. Did you understand what I had presented? And just getting them to repeat it back to you to see if they actually have understood it. Preparing for next class. Again, luckily, since professors have to put their PowerPoint presentations, at least here, online, they have information for the next class so they can download it and start reviewing it before class or before they attend that class. Managing behaviors, again, some of that what we might view as socially inappropriate behaviors. How do we manage those? Do we use an ignore procedure, or how do we redirect them? How to effectively help them work within the classroom setting while not disturbing the education of other people and enhancing the education of those individuals? And techniques to reduce outside distraction. And I know sometimes that these probably can be controversial. However, I have seen that individuals with ASD, they do pretty well. So sometimes with the fluorescent lighting, that's a visual stimulus, and that sometimes they have difficulty focusing, especially with the flickering of those lights. So I've had kids actually come in wearing sunglasses Again, nonverbal communication. If I see an individual wearing sunglasses in the middle of a lecture hall, I think they're not paying attention. However, that's just a strategy for them to be able to reduce outside stimulus that they could get distracted by and more focus on what they're trying to do. Headphones. And it's more than just wearing headphones, it's wearing headphones while playing music. Obviously, we don't want the music to be too loud because then they're listening to the music instead of listening to the lecture. However, the drowning of the music actually helps them drown out other noises, especially in a large lecture hall, when on a lower volume and be able to attend as long as they can hear the professor or the teacher speaking in front of the classroom. And obviously sitting in the front row because they're less likely to have visual distractions and auditory distractions. And sometimes we might consider we need to start making sure people have success in college. And well, we find it's easier to learn to do things the right way first instead of having them do it the wrong way and then try to teach the right way. So passing sometimes class, we have letter grades for a reason. It's just how well we're doing stuff. But just presenting the pass-fail option in some certain courses, getting them used to college, getting them used to all the, especially in the beginning, what the changes are, and having them achieve success in what they're doing, and then gradually fading them into what would be probably the normal graded courses. So that way we can build up confidence with them and having them pass courses and then presenting the graded material. And then we have outside the classroom. There's so much information here. I've gone through professors, other students in the classroom academics. We haven't even gotten to personal information yet. College is completely a maze. You have to navigate this maze. So what can we do outside the classroom? Well, thank goodness we have SSD. And I'm not going to focus on this. There's things, especially through the IDEA Act and what services they can get through the law that we need to be able to access. Maybe tutoring for the academic material, providing more structured support because we know that ASD does well and does better when there's structure in their lives. Again, I've had this on here a couple times. Maybe it's important. Teach study skills. Again, it's important to know how to study. Academic mentoring. Advanced registration, again, the planning, so the executive function, the planning, what classes, I'm going to be a history major, what classes do I need? Because I need more than just the history classes. I do, unfortunately, need some of those humanities and social sciences to be able to have a complete course load to graduate, then which means they need assistance with course selection, then help with time management. So helping them start planning out the organizational piece that they need in order to complete everything they need to complete and be successful as possible. Especially when you think of, I believe the rule, it's 2 or 3, it's 2 to 3 hours of studying for every hour in the class per week. So I believe here, unless it's changed, 12 credits to 18 credits is full-time. So if we have 18 credits, usually I believe those correlate to how many hours in the classroom you are. So just at 12 hours of class time a week, after going at 3 hours of studying, that's 36 hours of studying that we need to organize and plan every week, which can be quite difficult. So in that sense, too, when maybe we stick with the 12 credits and not bump it up to 16 or 18, so help them manage their course loads. Then even just organizing their class materials. Okay, what system am I going to use in order to keep everything organized? Am I going to have a binder? Am I going to have a folder? Is everything electronic? If everything's electronic, where in the world on my computer is it? Being able to organize that. Assistance for working in groups, because there's a lot of group work that occurs in college, and even a peer mentor. A peer mentor could be someone that probably is in some of the same classes as them, someone that can help them navigate some of that academic piece, but also some of that social piece too, even if it's being just the voice in the back of your head, hey, so-and-so is trying to get your attention. Someone there could be there to help provide some supports in them in their natural environment. We also have to think about outside the classroom, obviously in mental health. Well, with the roommate issues and transitioning, it's being difficult. There's a lot of anxieties, so we need to help develop or promote or maintain coping strategies and independent living skills, which I'll get to in a minute. And then using the extra help when it's available, office hours or even study sessions that might be available for certain classes. And then lastly, for academics, exams. Well, the standard one for examinations is extra time in a quiet location, which will help immensely. So when you have a quiet location, again, it's reducing distraction, because even though you're in a large lecture hall where everyone should supposedly be quiet while you're taking the exam, it's not necessarily the case. So providing them an opportunity with an environment with less distractions and not a time pressure in order for them to complete the work, they should be as successful as they possibly can. And I think if I have time, I don't know if we will, because I want to save time for questions. There's a video that I was considering showing. It kind of condenses everything that we've talked about here and presenting it through the eyes of a few, briefly, individuals with ASD who are in college. And one male says, well, with exams, not only do I have extra time and quiet location, I have someone to read the exam for me. So it's kind of providing the material in the multiple modes of I can visually see it and I can hear it to be able to best understand what the question is actually asking me. We also have the personal domain, which is I like to break down into activities of daily living and interpersonal skills. So when we look at this list, this is pretty much a standard list for anyone going to college that they're going to have to complete. However, knowing that individual with ASD has issues with executive functioning, theory of mind, and weak central coherence, social skills, and everything of that nature, these things are going to be more difficult for them. We need to start helping shape these behaviors in order for them to be successful. Because if you're not successful outside the classroom, more than likely you're not going to be successful inside the classroom. So first we have our interpersonal skills. And what do you know? There's self-advocacy again. So we need self-advocacy across both domains, the academics. Sometimes it's as simple as disclosing. And what are we disclosing? Are we going to go out to the professor and tell them, by the way, I have autism? Or are we going to simply say, you know what? I have difficulty understanding something, so please tell me when I'm doing things right, and please tell me when I'm doing things wrong. That's something that each individual has to decide on how they're going to disclose, what they're going to disclose, or even if they're going to disclose. They have to be aware and state when they don't know. Because if they don't state when they don't know, especially in college, we just assume that you know. So and let their needs be known and ask for clarification. So if I don't understand, when is the right time and I need to ask, can you tell me that in a different way? If you look at this in self-advocacy within the peer group too, again, disclosing. Okay, am I going to tell my peers that I have ASD? Am I going to tell them, you know what, I'm not going to understand you, so make sure you're very clear with me? Are we going to tell them anything at all? You have to be able to stand up for yourself in peer groups and not be taken advantage of and fall into peer pressures, whether that be things such as drinking or illicit substances. In college, I think, we have to understand that they're going to be exposed to that, especially underage drinking. Unfortunately, it's part of the environment they're going to be exposed to. Are they going to be able to handle those social pressures at that time? And can we provide them with the skills to advocate for themselves, to say no and make the smart decisions? Which again is then just letting their needs be known. Campus activities, obviously, especially when you go to U of M, there's a lot of outside campus activities and off-campus activities, how they're going to use their skills and interact within each of those environments. The social pressures, like I had mentioned before. Relationships with friends. Okay, who's actually my friend? Because we don't want them to be taken advantage of. Is someone my friend, or is it someone I just go to school with? Are they just in my class and I know them? Preventing exploitation. And then probably the biggest thing, or one of the bigger things, it's all big, romantic relationships. Well, this is also a time that people date. You probably start dating in high school. Maybe that's not an opportunity that they were afforded to during that time. They have more time here. Okay, what does this actually mean, though? So within this, we have to socialize. Relationships, dating, are already difficult enough as it is for those who may not have ASD, and reading social skills, trying to be able to have that theory of mind and what is my significant other thinking. I know, because my wife still doesn't think I understand what she's thinking at times. And then what supports when they're encountering different things, such as, well, what happens when it comes down to things like safe sex or consent, things of that nature. There's research that shows that we can teach abstinence all we want, and it's like, don't push the red button. If you teach me not to push the red button, more than likely I'm going to push the red button. However, if we teach to do things in a safe manner, they're more than likely to engage in those safe behaviors. So we need to teach them how to do things well and do things correctly, and not teach them what things not to do. All right, and then we have the activities of daily living that, again, everyone has, when they go into college, that they have to engage in, and engage in independently. So it could be things such as eating healthy, which probably involves buying food and making food. So then I need to plan out, okay, what food do I need? Because the the cafeteria is not open on Sundays, or I'm not going to be there for lunch on that day. I need to pack my own lunch, and I need to do this healthily. Well, I had someone tell me, well, that's just quick, Easy Mac and ramen noodles. Well, yeah, you're probably going to go through some time where you need Easy Mac and ramen noodles. However, they shouldn't be staples of your diet. So what other things can I do that are going to be easier to carry around for lunch? I can buy some sandwich materials and be able to make those. However, I also need to plan ahead in order to make that and store that safely for when I go to class. Financial management. Especially when we think of theory of mind issues, nowadays we've gotten to a point where no one carries cash, or very rarely carries cash. And cash is very easy, cash is very concrete. When I run out of bills, I no longer have any money. However, when we have debit cards, it's like this abstract thing of this is my cash. And every time I swipe this, there's money taken directly out of my account. It is very easy to over-withdraw when we don't realize how many times we're doing this and what we're purchasing, and be able to see, do I actually have the funds in this outside place that I can't see? We also have to think about maintaining their doctors, dentists, psychologists, mental health visits, and their medications. So not only with medications does it mean, daily packing them in order to take them to wherever they're going, but planning ahead and before they run out of medications and getting everything refilled. Now, how do we provide the supports with that? Well, then, we need to teach them that, and be better to teach them ahead of time. This is how we do it, get kind of like I mentioned with the IV process, get them involved with their medications. So this is what you take at this time here. We're going to pack this out for the week. We're going, we're running low, so this is how you go through it and go to the pharmacy and get more. Sometimes, too, if they're controlled medications, then we need to get them, months ahead of time, or try to get the approval months ahead of time. So when we know you're going to be out in December, so in November, we need to submit for this, and this is how you do it. Or something as simple as laundry, or laundry. Laundry is simple, or is laundry simple? So what does doing the laundry actually entail? Can I throw my whites in with my brights or my darks? Probably not. Delicates don't go in the washing machine. What things need to be hang dried? What kind of soap do I need? Because now we have the high efficiency washers, which need a specific type of soap that I can't use regular detergent for. Cleaning the lint filter on the dryer. That needs to be done so we don't start a fire. And then we think of the social aspect, too, of laundry, especially in the dorms. If you leave your laundry there and it's done, and someone's going to go in there and touch your clothes and remove it. So how do we navigate that social aspect of laundry, too? So we might view laundry as something as simple that almost anyone can do, when really there's so many steps to this, so many steps that I need to know how to do, and so many social interactions I need to know how to navigate in order to complete laundry. And we need to navigate these. As well as keep an idea of personal hygiene. Maybe sometimes they just need to be explicitly told, I'm sorry, but I think you need to take a shower. Or please go brush your teeth. They're not going to know, especially if you pull an all-nighter and studying, that I'm going to save time and get a little extra time to sleep. Well, no, I still need to get up in time and take a shower real fast because I know I smell. Wearing appropriate attire, although I would say going to some lecture halls while I was in school here, I think appropriate attire was your pajamas, when more than likely it's not. And dressing appropriately for the occasion. Weight management, the freshman 15, people gain weight when they go to college. How do we manage that? And then again, transportation. Especially in a campus like this, I need to use public transportation. I can't drive myself. So how do we actually get around to be able to do what I need to do? So in conclusion, there's a lot of supports that we need to provide and a lot of pre-teaching that we need to do. So these supports need to be in the classroom, so being able to help focus that academic piece. It also needs to be outside the classroom to help focus that academic piece and the social piece. We also need to provide education. Education for other students, education for professors, education for students with ASD, so that way we can provide them education, provide them the skill set to be able to navigate and function in the college life. And then there's resources you can do, or you can obtain from this, especially online. I highly recommend the Autism Speaks toolkits. They have a variety of toolkits, from things such as, okay, you have a diagnosis, now what, to we're thinking about going to college, what do we need to do? And then within all these supports and all these skills, it can be done anywhere. These are things that we can do here. We can do it in Auburn. We can do it at a community college. We can do it in a trade school. So it doesn't matter where the post-secondary education is. These are still techniques that we can use in a variety of settings. So I think we're going to save some time for questions. So unfortunately, we'll skip this, but you can find this on the Autism Speaks website or on YouTube. Are there any questions? Just going to grab a speaker or a microphone.
Hi. First off, you've mentioned Autism Speaks many, 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 many times in your presentation.
Yeah.
And the autism presentation earlier this week was talking about the rhetoric of Autism Speaks as an organization. And I know that they have done some good things, and you're pointing to those, but I was wondering if you'd be interested in framing some of their good things in the context of the controversies around them as an organization undermining persons with autism.
You said, so the material present undermining individuals with ASD? The organization. Well, unfortunately, I have to say I'm unfamiliar of that. I'm looking at them strictly through...
Okay, if you're unfamiliar with that, let's save it for afterwards.
Okay.
And go into a different thing.
Yeah.
A question that you didn't mention was financial aid and planning for financial aid and how to do that. And one of the things I found for my son, who's on the autism spectrum, is he got awarded work study, but he's completely incapable of getting a job. He applies and applies and applies, but never even gets an interview. And there's a whole world of complexities to work, study, college life, and being on the autism spectrum.
Right. So especially with financial aid, you're right, that takes a lot of planning and organization and pre-planning, especially because a lot of that has to be done before you even accept your college admittance to wherever you go to make sure you can afford to go there. So with that, especially with at U of M, I know there's a variety of departments here that would be able to help with that, maybe even the SSD department. There's also, I would look online and provide assistance. So that financial management too then, so it's kind of that piece of, okay, I'm going to college, but college actually takes money when I don't have that physically in hand. You know, how do I obtain that? So it's going to have to take some planning and some teaching in the sense of going through before college even begins, and but this is where the money's come from, and by the way, you're going to have to pay that back, and how we're going to do that. As far as the work study, so it sounds like he's been presented with the work study funds, possibly, like most kids are, but he's having difficulty obtaining it. With work study, there's obviously a variety of different opportunities, but to not get too specific, because it's unfortunately not in a clinical environment, I would use routes like SSD in order to see what the other opportunities are there, maybe even the work study office, to see what their suggestions are, because they'll be able to help you better navigate that.
Probably can be loud enough without that. Can't hear me. Oh, okay. First, I really appreciated, I thought, a really nice description of the diagnostic transition from DSM-4 to DSM-5.
Thank you.
Because my question is kind of evolving in that direction.
Okay.
And being familiar with Dr. Lord's work and some others that found that the differential use of Asperger's, for example, versus ASD at the same level of severity, not only due to the availability of resources, but also to SES status and race. So that's really interesting research. Kind of here's my question. What is the fate now of students, persons that used to be diagnosed ASD who are now, Asperger's, under the new criteria, who are probably subclinical, have a lot of social deficits, don't have any of the RRBs or stereopathy, but have significant sort of social impairments along the lines of those criteria A symptoms? Do you think most of those people are now going to be social communication disorder diagnoses, or how do you see that going?
Well, more than likely, I would say it's probably going to be under the social communication. But with the measures we have, we know they have good sensitivity and specificity. So even if there's the slight restricted or repetitive behaviors, we're going to be able to pick up on that and still place them under that autism spectrum umbrella. But then when we know, I believe it's the PQ16 addition and deletion, that those are the kids that are probably going to fall more under the social communication disorder, because we're finding in research studies with those that they have a lot of the social communication pieces that are deficits and not any of the RRBs. So it is probably is going to be captured under there, so we can still provide supports in that area. Hi.
I'm wondering, and I don't know, Larry, if this is a question for you or not, but in talking about the accommodations, you were talking about the number of credits and thinking about lowering that. And I know that that's one of my concerns for my son. Just it was interesting to seeing all these things in a list, because I knew that there was a lot, but there's even more than I imagined. So I think one avenue to success would be to take it slowly. So how accommodating are schools in allowing freshmen to take half? Or
Well,
whatever.
unfortunately, there are guidelines, especially when you think financially, of like what considers full-time and what considers part-time. Obviously, if we can do part-time and the financial restrictions aren't there, or we know we can handle it financially, it probably is best and to slowly shape it in there. But then, so usually schools are accommodating for that. You could talk to the SSD office, the financial aid office even might be good to understand and talk to with them. And sometimes it depends on also, I believe, and I could be wrong with this, with what school it is versus what equals full-time. So, and lengthening it out would be a good idea, and we might even be able to start during the summer and the spring semesters, where we know the full-time credits are reduced. So it's usually like 6 credits, which is 2 classes. Granted, you're probably meeting a little bit more, but because it's a shorter period of time, but then it still offers an opportunity to, under that reduced credit load, to still be full-time and get access. All right, well, thank you very much. Oh, one more, I'm sorry.
With the Twitter audience, there's a very, very active conversation going on with one person in particular about preparing the kids for college, and how she's talking about how with regular kids, you need to start teaching them some of these behaviors when they're 3. But with the kid on the autism spectrum, it might not be until they're 8 that they're able to get it. And that's with the goal of eventually going to college. And one of the things that she suggested is perhaps having some sort of transitional program rather than starting them in college at the usual age, and then having them go into proper college in their mid-20s when their social emotional maturation is more of a match with the other kids. She also said that a really good college that attracts brilliant, genius kids who are entering college young will have experience dealing with 12-year-olds, and that if the faculty understand how to integrate a genius 12-year-old into their college class, they should be able to cope with kids on the autism spectrum. Anyway, it's a very interesting conversation. She brought up some interesting points. I'm sharing some of those from the Twitter audience, and I'll try to get you the rest of that conversation later.
All right, well, thank you. All right, well, thank you. If you guys have any other questions or anything more specific, always please feel free to come up. Thanks for coming out today.